Medical experts are raising concerns following U.S. President Donald Trump's stunning comments urging pregnant women not to take Tylenol, claiming a link to autism despite a lack of evidence.
Take Tylenol. Don't give Tylenol to the baby. I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot.
Top medical groups say the science just isn't there. Medical experts say acetaminophen, the active ingredient in Tylenol, remains a safe and appropriate option to treat pain or fever during pregnancy. And the company that produces Tylenol also says there is no credible evidence linking the drug to autism and is urging women to speak with their doctors before taking unproven medical advice. As for Health Canada, also saying there is no conclusive evidence linking the use of acetaminophen in pregnancy to defects at birth or in later development. Joining us now to talk more about this issue is Doctor of Public Health candidate and expert in clinical pharmacology and toxicology, Sabina Vohra-Miller. Thank you so much for joining us today.
Thanks for having me.
I want to ask you, when you see an administration giving sweeping medical advice that is not data-driven, or at least data that has not been produced as per that news conference, what is it like for you in the medical world to see that play out?
Yeah, well, this is just not how science is done, right? And so first of all, you're having science by press release. There is absolutely no report, no data that came with this press release. Even today, 24 hours later, we've seen absolutely nothing. There is no evidence, we know that. And so we're trying to understand where these claims are coming from. And unfortunately, they're coming from some of the top institutions, in the world that we typically look up to for good, credible information. Instead, what we're seeing is that these top institutions are actually the ones driving mis and disinformation.
So let's talk about what we do know. Tylenol or acetaminophen has been around for a very long time. It has been safely used in pregnant women for a long time. So what information is out there when we talk in the millions and the studies and the data? What do we have right now to back this up?
Yeah, so I think let's be very clear. The science here is extremely clear. There's absolutely no causal link with the use of acetaminophen or Tylenol in pregnancy and any sort of neurodevelopmental concerns, so autism, ADHD, or any other concerns, right? And in fact, there's global consensus on this, right? So it's not just the American society, so the American College of Obstetricians and Gynecologists, but even the Canadian version, the SOGC, as well as the Society of Fetal Medicine. And in fact, our European colleagues are saying the exact same thing. There is agreement amongst all of these global associations that there's absolutely no causal link between Tylenol use in pregnancy and these neurodevelopmental concerns. And in fact, we have some fantastic studies that have come out, robust studies. They're called sibling control studies. And the reason we do that is because we know things like autism have a strong genetic component. And so these studies that have been done, they're being done in over 2.5 million children. And over a long period of time, they looked at children from 1995 all the way up to 2019. So that's a lot of data. And what they did in these sibling control studies is they actually looked at siblings who were exposed to Tylenol or acetaminophen in utero and compared it to another sibling in the same family that was not exposed to it. So this way, we're actually correcting for any genetic confounders that may exist. And we found that when we did these amazing studies, there was absolutely no link whatsoever between the two. So we do have incredible, strong data that shows no link whatsoever.
Assuming this is going to create widespread confusion, assuming a number of physicians are fielding calls both in Canada and the US, with a lot of people just asking questions, how are you feeling moving forward? This is not the first time we've had a conversation like this. We've talked about anti-vaccine, RFK Jr. We've talked about the measles outbreaks that we have seen and the messaging and the rhetoric there. So sadly, this is probably not going to be the next time we have a conversation like this. So how do medical professionals fight back?
It's really hard. I mean, right now it feels like we're just putting out fires as much as we can, right? What I'm really concerned about right now is whether pregnant people, women would be very concerned in taking Tylenol or acetaminophen. It's the only safe choice for pain control and fever control in pregnancy. And I am concerned because untreated high fevers and even untreated pain in pregnancy has negative impacts on the fetus. So it's not just about not taking a drug, but it's also about what the impacts are about not taking those medications in pregnancy. And let's be clear here as well that access to effective pain medication is a basic human right. So we're denying pregnant people this basic right to pain relief and also things like high fevers. And I'm just concerned because I think we're going to see a lot of pregnant people out there anxious for no good reason, avoiding medications for no good reason. I think at this point, all of us in the healthcare community are just trying to alleviate these concerns, encourage people to actually speak to their healthcare providers because clearly, all of the healthcare providers, all the medical associations are saying the complete opposite to what this administration is saying. So we're encouraging people to go and have these conversations and get the actual responses, the real evidence, the real science from their trusted healthcare providers.
We could go on for a while. Sabina Vohra-Miller, appreciate your time and your insight today. Thank you.
Thank you.